Thank you, Chatura, for a very good question. At this time, we don't know how many scans or imaging tests are safe for people, particularly children. No medical professional society or organization has placed a limit on the number or type of scans that children can receive. And the reason for this is a very good one, because children's imaging tests are requested by physicians for a specific medical problem. And this means that the test should be justified. It means that the benefits of the test should outweigh any small risk from medical radiation. Risk from radiation has to do with four things. It has to do with the age of the patient at the time the study is performed. It has to do with the sex of the patient's genetic background, what genes they inherited from their parents, and lastly, how much radiation is delivered for the imaging tests and over what time period. Thank you, Bashir, for that very good general question. Over the years of studying the potential effects from ultrasound, there's really good news, and that is that there is no measurable increased risk to humans, and that's including fetus and embryo, especially when the equipment is used appropriately. And it's one of the reasons why pediatric radiologists around the world have really encouraged the use of ultrasound in children if it can answer the medical concern from the physician. Hi, Alex. It's obvious that you have thought a lot about this question, and you're really asking about the question of radiation risk at the low doses that are used in medical imaging. There are some excellent scientific articles that could answer your question more specifically. But in summary, I would say that there is reasonable, although not definitive, evidence that organ doses in the range of 5 to 125 millisieverts does result in a very small but statistically significant increase in cancer risk. And for this reason, particularly when imaging children who are more sensitive to radiation and who have a longer lifetime, it is important to use the lowest dose to answer the medical question. Hi, Sebastian. Thank you for asking another great question. You're asking whether or not exposure to radiation, even tiny amounts, increase your risk of getting some cancers. And the answer is yes. And from the best evidence we have, it appears as if the linear extrapolation is most appropriate. However, it should be emphasized when discussing stochastic risk that the risk increases, but there is still no certainty that the event will occur. There are benefits of medical radiation in imaging, and there are many. Because of imaging, the number of exploratory surgeries have dramatically decreased. Treatment for patients and children with trauma is much more specific, and often no additional surgery has to be performed. Surgery is more targeted and has really changed cancer treatment. In addition, hospital stays have been decreased. It really often can answer the question that is of medical concern for the child's doctor. So I think you can see that the benefits of medical imaging are many for children in particular.